Hi, my name is Fran. I'm a nurse here at Brown University. Are you Miss Marie Adelson?
Yes, ma'am.
Okay, Miss Adelson. May I call you Marie or Miss Adelson?
Marie's fine.
Marie. May I have your date of birth?
6/30/79.
Okay, and what brings you to the doctor's office today?
I just want a general checkup.
Okay. So today we're going to be checking your cardiovascular and your peripheral system, all right? Before we get into the hands-on part of it, I'm going to ask you some questions, all right?
Okay.
Okay, have you had any chest pain or tightness in the chest?
No.
Any shortness of breath?
No.
Do you feel the need to sleep on more than one pillow?
No.
Do you have a cough, an unexplained cough?
No.
Do you tire easily when doing physical activities?
No.
Have you noticed any swelling of the feet or legs?
No.
Do you awake frequently to urinate at night?
No.
Have you had a past history of heart disease?
No.
Is there a family history of heart disease?
No.
Okay. Have you noticed any leg pain or cramps?
No.
Any skin changes in the arms and legs?
No.
Any sores and lesions in the arms and legs?
No.
Have you noticed any swelling in the legs? What about any swollen glands? Have you had any?
No.
Okay. Are you taking any medication?
No.
Okay. Well, right now, since we have all this information written down for you, I'm going to do the hands-on part of the assessment, okay? Now, this entails me touching you and moving around. So if I start to bother you or tire you, or you get tired, or if I hurt you, you let me know, okay?
Okay.
Okay, so right now I'm going to perform hand hygiene. I'm going to clean my stethoscope because I'll be using this also to listen to different areas of your heart, okay, and of your the arteries and veins, okay? All right, Mrs. Marie, I'm going to ask you to just lay back for me, please. Good. Okay, so right now I'm going to inspect and palpate the carotid arteries. So what I'm looking for now is any pulsations right now from the carotid arteries, which I don't see, which is normal. The skin is evenly distributed. There's no lumps, masses, or bruising going on with the skin, or the texture looks smooth and even. I'm standing on the patient's right side because the artery on the right side is more easily accessible than the left. Okay? Miss Marie, can you turn your head just a little for me? Good. Now I'm checking the carotid artery, which is right here. Very good. Good. Okay, it's smooth contour upstroke and a rapid, slower downstroke, which is what we're looking for. Can you turn towards me, please? Good. Good. The carotid artery is palpable on both sides bilaterally. Again, smooth contour upstroke with the slower, moderate downstroke. The strength is nice and moderate is what we're looking for also. I would give her a grade for the right and the left, both +2. That's what we're looking for, right? So now I'm going to look for your jugular veins. If you can just look towards me, please. So now, right now, we're looking for the jugular vein. When Miss Marie is laying flat, we're looking for the external jugular vein, which collapses, which is what we're looking for. You don't see any pulsations, anything bilaterally for Miss Marie for the external jugular. Now, the internal jugular vein is not visible either, and it's located in the suprasternal notch, right? So what I'm going to do is ask Miss Marie to lay on this pillow for me. Good. Okay, so this simulates, the first pillow that she laid on was 30 degrees, the second pillow is going to simulate 45 degrees, and we're looking for pulsations, which we see. We would normally keep going up to 90 degrees if we thought we had any abnormalities, but she's in optimal health, so she's fine. So what I will do is palpate, and never palpate together, because you don't want to occlude the patient's airway. Good. Good. Okay, so we don't have any jugular vein distension, which would indicate usually some kind of a heart failure or CVP, cerebral cardiovascular insufficiencies. We do not suspect that with Miss Marie, which is good. So right now, can I have this one pillow again? Good. Are you comfortable?
Yes.
Okay. Now I'm going to look at what's known as the precordium, which is the area over the heart. Right now I'll be inspecting So what I'm doing is looking, and usually with the precordium, what we're looking for is the skin color, which is consistent with the patient's skin tone and normal ethnicity. There's no lesions, no bumps, no bruising going on with her. We're looking for the chest wall pulsation, and that usually occurs when the ventricle pulsates and hits the chest wall. Usually in thinner people or kids, it's more readily seen. Most women with breast tissue and heavier, most of us are heavier, it's not that readily seen, okay? So we don't see it here. But what I will do in order to palpate, I will use the pads of my fingers, right? And I'm going to palpate. Usually it's in the 4th inner space under mid-clavicular line, which is lined up with the nipple here. Right there. We feel the apical impulse, okay, which is usually 1 by 2 centimeters, and it's normal, short, gentle taps, and that's perfectly, I feel it, and that's what we're looking for, Miss Marie, okay? You okay?
Yes.
Okay, good. So that's fine with that. So now what we're going to do is auscultate. And auscultate just simply means to listen, right? I'm just going to listen. I cleaned my stethoscope already. What I'll be listening for are the valve sounds of the heart, okay? Okay, so right now what I'm going to be listening for is the aortic valve closing, which is on the right sternal border in the 2nd intercostal space, which is going to be the right side. I'm listening here. Good. Very good. I hear S1 and S2. Okay, now on the left sternal border in the same 2nd intercostal space, I'm listening for the pulmonic. Very good, S1 and S2. Okay, now I'll move down to the lower sternal border, which is right here. Now I'll be listening for the tricuspid. Good. And now here on the 5th intercostal space, mid-clavicular line, right here, which is in line with the nipple, I'm going to be listening for the mitral. Very good. Very good. Which has normal rate and rhythm. S1 and S2 noted, which is the boom boom sound that we listen for, and I heard that, which is fine. The systolic is heard during the S1, which is perfect and what we're looking for. There's no extra heart sounds, no diastolic murmur, no systolic murmurs noted. Do you have any questions for me, Miss Marie?
No, not right.
Okay, good. So this part concludes the cardiovascular. Now I'm going to move into the peripheral system. Miss Marie, can you please sit up for me, please? Good. Now, in the peripheral, what I'll be doing is checking the arms and the legs. So what I'm doing is checking the arteries, of the arms and legs to make sure that, you have sufficient blood flow. So first I'll be inspecting, which takes a look at Miss Marie's arms. The skin is evenly distributed, the hair is evenly distributed. She has a nice jewelry. There are no lumps, bumps, or bruising going on. Do you have any pain or anything when I palpate your arms?
No.
Good, okay. It's symmetric. I'm going to check cap refill. Cap refill just tells me, what I do is I pinch the finger and I look for blood return. Good, and that tells me that you have adequate blood flow to your extremities, which is excellent, and that's what we're looking for, right? Do you have any pain or anything?
No.
Okay, skin is nice and warm. Now I'm going to check the arteries here. Right now I'll check the radial arteries bilaterally by placing my 2 fingers here. Good. Good, very good. Okay, they're nice. I would give it a +2 normal. They're not bounding, which would mean that there's some insufficiency, so we don't have that. Do me a favor, Marie. Shake my hand. Okay, now what I'm checking now while she's shaking my hand is the epitrochlear lymph nodes. Usually they're not palpable in normal adults and healthy adults, and she does not have them, so that's what we're looking for, okay? If I suspected any insufficiencies, I'll be palpating the brachial arteries also, but I don't suspect any insufficiencies, so I'm not going to be checking for those, right? So now I'm going to check the lower extremities. Lower extremities they're even symmetric. Skin is nice and smooth and hair is evenly distributed. I don't see any lumps, bumps, or bruises. No edema. Does this hurt?
No.
Okay. The skin is warm, nice and warm, not moist. Okay, there's no shininess, no swelling, no edema, no pallor. Now I'm going to be checking for, I'm going to check cap refill. Again, it's just checking for sufficient blood flow. She has adequate brisk cap refill, which is a less than 2 seconds, and that's what we look for. Now I'm going to check for the peripheral pulses. First, I'm going to start here for the dorsal pedalis, which is right here on top of the feet. You just have to find them. Good. Okay. I feel them. They're nice and bounding. Now I'm going to check the post-tibial. Good. And here is where I would check the pre-tibial edema if she had edema, but she does not have edema. Now bend your leg for me, please. Good. I'm checking the popliteal, which is usually not palpable, but that's fine. Okay, and now I'm going to check what they call as a Holman sign. And usually a Holman sign is indicative of DVT in patients. Deep vein thrombosis is what we check for, and then sometimes patients that are epileptic, we can check and see if they're about to have a seizure with the Holman sign. So by doing so, I just push the leg back. Do you feel any pain?
No.
Any tenderness in your calf?
No.
Good. Now I'm going to check the other. Good. One more time. Good. Okay. So right now, I'm going to say that Miss Marie has adequate peripheral vascular system. There were no abnormalities noted. Do you have any questions for me?
No.
Okay, thank you. This concludes our assessment.
Thank you.